Hi, my name is Gloria. I'm 31 years old, and I was diagnosed with stage 4 colon cancer at the age of 28. Prior to my diagnosis, I had been living the dream, really. I attended Duke and Stanford Law School, and I was well on my way to a very promising career at my law firm, O'Melveny and Myers. I was having a great life, a great time with my friends. I had some GI issues that I sort of pushed to the side. I was going to the restroom quite frequently, starting in January of 2010. They were never pretty times in the bathroom. I was getting bloated at night, and symptoms started to get worse as the year progressed. I wound up seeing my general practitioner in July and explained to her, look, I'm having diarrhea 6 times a day, and look at my belly is all blown up, and she told me to take probiotics. And so she kind of blew it off, and I did too, and she did not refer me to a GI doctor. And a couple of weeks later, when the probiotics really didn't work, I called her office and said, look, I need a GI doctor. And they gave me the number, and I called the office, and they said the first appointment would be September 21st of 2010. And I remember feeling a very sinking feeling at that moment. I called my husband, and I said, the first time to see this doctor is September 21st, and that's going to be too late. And I was right. I wound up having severe symptoms, couldn't keep food down during the second week of September, and wound up having emergency surgery because I had a complete intestinal blockage from the tumor in my colon. Emergency surgery was on September 19th. So 2 days before I would have met with this GI doctor, I had emergency surgery, and that is when I was staged at stage 4. And that, it threw everybody for a curve. Nobody expected it, especially my surgeon. He exited the operating room in tears and told my family that I would never play basketball again, never lift weights, never practice law. I would die within a year, maybe 2 years at best. And my life would be deciding about how much life I wanted to live versus how much pain medication I wanted to be on. And I remember my mom delivering the news to me, and I did not, I was never afraid. I was never sad. I was never scared. She wound up telling me, it's stage 4 and it's very aggressive. And I said, well, I'm an aggressive girl, so what do we do? And from there, my entire network mobilized. My attorney friends, my colleagues, my friends from Duke and Stanford, my family. I had interviews with doctors and surgeons immediately. Even when I was still in the hospital, I had these phone calls. And the Thursday after I was released on a Sunday. 4 days later, I met with Dr. Lenz, and I knew pretty much right off the bat that he was going to be my oncologist. His confidence, his leadership, his knowledge, and the fact that he wasn't, feeling sorry for me. He didn't say, oh, wow, such a young girl. He was very focused and determined on what we were going to do. So I loved his positivity and his energy, and I just knew he was going to be my partner in crime. So that's a story of me finding Dr. Lenz, and that has turned into a very special relationship. And we've done a lot of work together for my health and for our nonprofit.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.